Okay, so I'm going to take our little screen over here so you can see it. So this is my skull again. This is Snaggletooth Joe. You can see he's missing some teeth. We're going to take his skull cap off, meaning we're going to take this top bone off so that we can see in the inside of his skull. So this is my eye sockets. So I'm flipping it around like this so that I can see this bone right here. So you can get it where you can see it real good. That bone right there is the ethmoid bone. This ridge from that ethmoid bone, that rib or that ridge is called the crista galli. This plate right here that has holes in it, that plate is called the cribriform plate, and those holes are called the olfactory foramina. Foramina are just tiny holes. So again, this entire bone right here is the ethmoid bone. This ridge in the middle of that ethmoid bone is called my crista galli. This plate right here with the holes in it, that plate is called my cribriform plate. And the holes in there are my olfactory foramina. Then I focus out this area of the bone right here. You see that? This area of the bone right here, that is your sphenoid bone, seen in purple on that image on the screen. Then here and here, seen in red, those are your temporal bones. Remember, your temporal bones are either side of the skull. And then this bone here with the foramen magnum hole right here, this is the base of the skull. So this would be my occipital bone. So on this picture, in red would be my temporal bones. Then in purple here is my sphenoid bone. That's a PH, by the way, PH, sphenoid bone. Then this bone back here is my occipital. And then up here in green is my ethmoid bone. You do have to be able to identify all those parts from seeing this skull opened up where we've taken the top off of the skull and we're looking inside of it. Okay. Okay, then the hyoid bone. The hyoid bone is going to float in the upper throat. This bone doesn't articulate with any other bone in the body. This hyoid bone is a bone that if they're trying to check the reason or the cause of death, if that hyoid bone has been fractured or broken, they know that that person has been strangled because that bone gets broken in strangulation. Okay, there are two parts of this hyoid bone you have to know. The back ends of this hyoid bone is called the greater horn. And then these two fangs, these two fang type structures, those fangs are your lesser horns. Then all of this area right here in the front, this area is called the body of the hyoid. So again, the hyoid bone is going to float in the throat. It has three structures you have to know. The backs of it are called your greater horns. The little fang structures are called your lesser horns. And the whole front area of that bone is called the body of the hyoid. And again, the hyoid bone doesn't articulate with any other bone in the body. It's going to attach to a bunch of muscles. Okay, now let's go over this sphenoid. Remember I said you can see this sphenoid bone. All of this is the sphenoid bone. Okay, inside that sphenoid bone, you're going to have the lesser wings and the greater wings. Right here are the lesser wings. And back here, the deeper depression, that's going to be the greater wings. So lesser wings and greater wings. Then you have this big groove right here. That big groove right there is called your sacca turcica. Sacca turcica. Then you have these two holes here and here. Those two holes are called your optic canals. And then the bridge between your optic canals right here is going to be your optic groove. So this bone is called your sphenoid bone. This structure is called your lesser wings. This structure, all this back here, is your greater wing. This indention structure right here is your silica turcica. These two holes right here are called your optic canals. And the bridge between those optic canals is called your optic groove. And that's what you're seeing on this picture right here. I would never ask you anything from this one down here, okay? But you do have to know these structures. Like I just pointed out, you have to know those structures right there from this viewpoint right here, okay? Okay, now let's talk about the mandible. So the mandible is this lower jaw. I'm going to take that lower jaw off so that it looks just like this, okay? So this is the lower jaw called the mandible. There are some parts in here you have to know. So if we turn it to the side, you have this blunt end right here. This is your condylar process. And then the pointy one right here is your condylar process. So condylar process and coronoid process. Condylar process, coronoid process. Your coronoid process is the tip, okay, or the spikier one. In between those two processes, this is your mandibular notch. Then you have this area right here. This area is called the ramus. And then this bend where it takes a different turn, this is called the angle. So again, the back portion that's more rounded, these are going to be your condylar processes. Then you have the two pointy ends right here and right here on either side. So those two pointy ones. Those are your coronoid processes. Then you have the two grooves. Those grooves are called your mandibular notches. Then you have this area here called the ramus. And where it takes this turn here is the angle. Then when you look on the front, all of this is the body. So all of this is the body. Then you have, there we go. Then you have this little hole right here. There's a hole here and a hole right here. Those holes are called your mental foramen. Remember that landmark in the front of the jaw there was your mental landmark. So those holes are called your mental foramen. Then on the lower jaw, you have, remember those bumps where the tooth goes into the bone. Those bumps are your alveolar processes. And this edge right here is your alveolar margin. Then if you look right at the front of that mandible, you see a little protrusion right there. That protrusion is called your mental protuberance. Mental protuberance. Then if we look at the inside of this mandible, so now we're looking on the inside of it, this groove right here is called the mandibular groove. And it's on either side, mandibular groove. These are the inner ear bones. The inner ear bones all together are called your ossicles. So all three of the inner ear bones together are called the ossicles. With an S, ossicles. From the exterior side of the ear, this is the external part of the ear, to the inner ear over here. In order, it goes the malleus, then the incus, then the stapes. Malleus, incus, and stapes. These are the smallest bones in the body. These are actually some of the most difficult bones to break because they are protected by all of that bony cranium, and they're inside, the very inside of that skull. So a lot of times these three bones are the most difficult bones in the body to break, even though they're very small, fragile bones. Okay, now we're going to take that skull and we're going to pop him upside down again. So he's back upside down. So remember, this was the mandible. That's the lower jaw. This is the maxilla, or the upper jaw. This is the palatine bone. This blue bone is the sphenoid bone. These two orange bones are your temporal bones. And this bone here is your occipital bone. There are some holes that you have to know in these bones. So let's get to where you can see it. This bone, these holes right here in the sphenoid bone, right here and right here, those are your foramen ovale. They're oval shaped holes, foramen ovale. Then these two cuts right here, these are your foramen lacerum. They look like little lacerations. They're kind of little jagged cuts right here. Foramen lacerum. Then we go down from that one, and we're going to have the carotid canals. So right here and right here, see in that orange temporal bone, those are your carotid canals. Then if you tilt it way down, you can see, you get it to where we can see it real good. See those little deep cuts right there and right there? Those are your jugular foramen. Okay. And then of course your foramen magnum is here. So again, going up into that sphenoid bone, those are your foramen ovale. Then right here on either side of this yellow bridge, right there is your foramen lacerum. Then these big orange ones here, those are your carotid canals. And if you tilt it forward, you can see these big holes right here. Those are your jugular foramen, and then your foramen magnum. Find them on your colored skull first, and then go to your white skull and find them on your white skull. Okay, the fetal skull. The fetal skull does not have all of your cranial bones fused together. So you have these little soft spots. Those soft spots looks like this. All of that is called a fontanelle. So you can see that top fontanelle, and you can see a side fontanelle right here. Okay. So the soft spots where you only have cartilage and no bone is called a fontanelle. And that again is only found in the fetal skull. It's our fetal and early child skull. So at a couple of months of age, that fetal skull will stop closing up, and that cartilage bands in that fontanelle will be replaced with bone cells. Okay, there were a few things not covered in there. So let's go over those few things. Okay, so in this picture right here, we're at this again. So if you can see, there's like two little wing shapes on this sphenoid bone on either side. The outside wing on either side, that is your lateral pterygoid process. So it's a PT word. So the P is silent, okay? Lateral pterygoid processes. Then this middle one, these middle ones are your medial pterygoid processes. So I'm going to show you on this side, and then I'll turn it over. So that one is your lateral pterygoid process. This one is your medial pterygoid process. Then over on this side, this one is your medial pterygoid process, and this one is your lateral pterygoid process. Then on your temporal bone, so if we take this temporal bone, let's see, let me move the mandible a little bit. You have two different processes coming off. You have this pointy process right here. Those sharp pointy processes are called your styloid processes. Then you have this huge one right here. This is your mastoid process. So the pointy ones are your styloid processes. The massive ones are your mastoid processes. Then you have this ear canal. That ear canal is called your external acoustic meatus. External acoustic meatus. Then on this cheekbone right here, remember your cheekbone right here in red is the zygomatic bone. You have some different portions of the zygomatic bone you have to know. This entire thing is called your zygomatic arch. So the entire thing is your zygomatic arch. This portion of your zygomatic arch is called your temporal process of the zygomatic bone. This orange part of that zygomatic arch is called your zygomatic process of the temporal bone. So what you're going to do is you're going to name what direction it's going to go in first, then what bone it sits on. So again, this part right here is going to go towards the temporal bone. So if it goes towards the temporal bone, it's a temporal process of this zygomatic bone. Whereas this one in orange is going towards the zygomatic bone. So this is the zygomatic process of this orange bone called the temporal bone. So zygomatic process of the temporal bone. Okay. And this entire thing would be zygomatic arch. Okay, let me see if we've missed anything, being we missed those. I don't know what happened to those drawings. Let me pause for a second. Let me double check. Okay, before we move on, I wanted to show you the hyoid bone. Okay, so this is the hyoid bone right here. That's the hyoid bone. Come on, focus in. There it goes. This is the hyoid bone. You turn it to the back. Let me go back to your picture where it showed the hyoid bone. There we go. Okay, so this is the hyoid bone. You can see the back parts here. Those are going to be your greater horns. Then these little fang teeth right here, those are going to be your lesser horns. So these fangs right here are your lesser horns. And then all this front area of that bone, that's the body of the hyoid. So this bone is the hyoid bone. The back portions are your greater horns. These little canine little extension up here, they look like little canine teeth, little fangs. Those are your lesser horns. And all of this in the middle, in the front, is the body of the hyoid. When you're looking at it on the skeleton, okay, this is up in the throat area right here. You can see that in this throat area, this bone right here is the hyoid. So again, it's going to be in this throat area right here. That's the hyoid bone. Okay. Now let's move on to, I'll go back down. Okay, now let's talk about the sternum. So the sternum is your breastbone. So this is the sternum right here. This big area up here, that is called the manubrium. This is the body of the sternum. And then this pointy end right here is the xiphoid process. So all of this bone from here to here is the sternum. This part of the sternum is called the manubrium. This part of the sternum is the body of the sternum. And then this point here is the xiphoid process. Then looking at the ribs, you have true ribs, false ribs, and floating ribs. Your true ribs are up here, and it's going to be one rib attached to one cartilage attached to the sternum. So one rib, one cartilage, sternum. One rib, one cartilage, sternum. So all of these would be true ribs. All of these would be true ribs. Then down here, you're going to have a rib that is going to share a cartilage. So here they're sharing a cartilage that is attached to the sternum. So if they share some of those cartilages, they're called false ribs. So all of these, where they share one cartilage going up to the sternum, these are going to be your false ribs. Then at the bottom down here, you have these two last ribs, this rib right here that ends right here, and this rib right here, this little bitty one. Those do not attach to the sternum at all. They look like they just kind of float there. Let me turn them around this way. You can see this rib ends right here, and this ends right here. So these two ribs end right here and here, and there's no band of cartilage attaching them to the sternum. So these are your floating ribs. Okay, let's talk about the rib itself. Okay, so you have the flat ends. So there's little flat surfaces here. Those flat surfaces are your articular facets. Then all of this is called the head. Then between this bump, I don't know if you can see it, but between this bump here and this bump here, this area is the neck. So all of this is the head. Then between those two bumps is the neck. Then all of this is the body. As it makes its turn, so you can see here it makes the turn, that is the angle. And then on the very underside of the rib, there is a groove right there. That groove is called the costal groove or costal groove. Costal means rib. So that costal groove is sitting on the underside of that rib right there. That's the costal groove. So again, this is your rib. These flat surfaces here are your articular facets. This entire structure that I'm touching right here is the head of the rib. This area right here between these two bumps is the neck of the rib. All of this is going to be the body of the rib. Where you see it make its turn, this area is the angle. And then underneath, there's a groove right here. That groove is your costal groove. Now let's talk about your vertebrae. Your vertebrae are going to make up the spine. You have cervical vertebrae, thoracic vertebrae, and lumbar vertebrae. So I'm going to go to this one and I'll go back to the other one. So up in the neck, these are called your cervical vertebrae. They're in the neck. Okay. Your cervical vertebrae are going to have 3 holes. One hole here, another hole here, and a big hole right here. So all of your cervical vertebrae will have 3 holes in them, and they're all found in the neck region. Okay. Let's talk about the parts that you need to know on these cervical vertebrae. So this big hole right here, that big hole is your vertebral foramen. Foramen again means hole. So this vertebral foramen means the big hole in the middle of the vertebrae. Then these 2 side holes here are your transverse foramen. Transverse foramen. Then this side goes out like this, and this side that goes out like this, that's your transverse process. Then I'm going to grab a different color. This red part that sticks down here and this red part that sticks down here, that is called your pedicle. Then you have the sides that go down like this. Those sides are called your lamina. Then we have this part right here that arches over. That is called your vertebral arch. And then you have this point right here. That point is the spinous process. Okay, so again, your cervical vertebrae are going to be all the vertebrae found within the neck. I'm going to show you a cervical vertebrae now. Okay, so this is a cervical vertebrae right here. You know it's a cervical vertebrae because it has 1, 2, 3 holes. This hole right here is called your vertebral foramen. These 2 holes on the side here are called your transverse foramen. These sides right here and here, those are called your transverse processes. I forgot to tell you this big area right here. This big area right here is your vertebral body that my finger's rubbing around. Then you have the 2 necks. These necks are going to be your lamina. This arch right here is your vertebral arch. This big spinous thing right here, that's your spinous process. And then right here and right here, where you have a little bit of it go straight down, right here and right here, that's your pedicle, right there. You can see it better on this side. So right here and right here, on either side of that vertebral body, where it goes down, that's your pedicle. Okay, so let me draw a little picture here, because you know I love to scribble. Okay. Okay, let's see if I can scribble this halfway decent here. Ooh, maybe not. Okay, so you see how that's kind of resembling this vertebrae right here? Okay, so those sticks going down are your pedicles. The wings coming down, the top of those wings is the lamina. So right here and right here would be the lamina. Right here and right here would be the pedicles. And this top part right here is the spinous process. You have two special cervical vertebrae. One is called the atlas and one is called the dens. Those real quick. Hang on a second, they've all gotten tangled up here. Okay, so this is my atlas. Okay, my atlas is my first cervical vertebrae. This atlas is going to be the first vertebrae that skull sits on. Okay, this is the atlas. Then my axis, this is my axis. My axis has this big appendage sitting on top of it. That is called the dens. So this specific vertebrae is called my axis. And the extra part that you have to know here is the dens. So this atlas, let me grab him again. That atlas is going to sit upon that dens so that that head can spin around. Okay. Make sure you know that these two are named atlas and axis. Then the next set of vertebrae we have are thoracic vertebrae. So your thoracic vertebrae are going to be behind the rib cage. And these are your thoracic vertebrae, again, behind the rib cage. Your thoracic vertebrae are going to have some of the same parts, but the first thing you'll notice here is there's only one hole in your thoracic vertebrae. Okay, so this one hole, same as the hole before, is your vertebral foramen. This arch right here, that arch is your vertebral arch. The two sides here are called your lamina. Your wings that fly out, your wings make up your transverse processes. Then you have your legs coming down. Those legs are your pedicles. So that's your pedicle. Then you have the top here. This top is your spinous process. And then all of this down here is your vertebral body. Okay, so I don't know if any of y'all are duck hunters, but if you look at the first part of this or the top part of this vertebrae, it looks like a duck. So the head of the duck, oops, wrong one. Let me grab my pens again. The head of the duck is a spinous process. The wings of the duck are your transverse processes. The neck of your duck is your lamina. The feet sticking down here and here are your pedicles. Okay. When you're looking at your thoracic vertebrae, your duck looks like he's in motion. In other words, his wings are pointed up, okay, like he can push down to get thrust to be pushed up in the air. So your thoracic vertebrae, his wings or his transverse processes are up, okay? That's going to be different from the next vertebrae we look at. The next vertebrae we're going to look at is the lumbar vertebrae. Your lumbar vertebrae are going to be found in that deep curve of the spine. So in that deep curve right there, all of those vertebrae are your lumbar vertebrae. Your lumbar vertebrae has some of the basic parts that we've already learned. So this big hole right here is your vertebral foramen. This little arch right here is your vertebral arch. And all of this is the vertebral body. Now thinking back to our duck analogy, the head of the duck, same as the head of the duck on all of them, is the spinous process. The wing of the duck is the transverse process. The neck of the duck here and here are your lamina. Then you have your feet coming down. Your 2 feet are your pedicles. One thing you'll notice difference between the lumbar vertebrae and the thoracic vertebrae is now those wings or those transverse processes are more straight across, whereas in thoracic they were like that, okay, because he's getting, think of your duck as trying to take off, so he's pushing his wing real far up and then pushing down to get thrust. Okay, so now we're going to go back a few slides where all of them were pictured together. Oh, let me erase the rest of my scribbles. So again, this first one, number 1, is your cervical vertebrae. You know that because he has 1, 2, 3 holes. My second one here is my thoracic vertebrae, and you know that because my duck, see, his wings are shaped like a V. That's my thoracic vertebrae. And then this third one here is my lumbar vertebrae, and you know that because his wings are straight across. Those are the simplest ways to be able to determine what type of vertebrae it is. Cervical has 3 holes. Thoracic, his wings are V-shaped. And then lumbar, his wings are straight out. Okay. Then you have 2 special vertebrae at the bottom. The first cervical vertebrae is called the atlas. The second cervical vertebrae is called the axis. So atlas is cervical vertebrae 1, and the axis is cervical vertebrae number 2. And there is a little appendage that sticks up right here. It's kind of hard to see on this picture, but that appendage that sticks up is called the dens. D-E-N-S, dens. Okay, now let's name some of these structures. Okay, let me erase a few of my scribbles first. Okay, now let's name a few of these structures. Find the spinous process. The spinous process, I'm going to circle in purple. So the spinous process in every one of those is the head of the duck. Remember, that's the spinous process. Now find the lamina. The lamina goes down the neck. So here and here are the laminas. Your lamina, think of this is a goose or a duck. The lamina are the necks in red there. Find me the pedicles. Remember, the pedicles are going to be the feet that go down. So here are the pedicles in orange for each one of these vertebrae. Those are the pedicles. Now name me or show me the transverse processes. The transverse process, remember, you're going to think of the wings. So these side parts, those are your transverse processes. Again, your wings or transverse processes are in more of a V shape in your thoracic, and they're pretty much straight across in the lumbar. So that blue is going to be your transverse processes. Where is your vertebral arch? The vertebral arch is shown in yellow. That's your vertebral arch. Show me the vertebral body. The vertebral body, I'm putting a big B on. So that is a vertebral body, where the big B, the big white B is. That's a vertebral body. Show me the vertebral foramen. The vertebral foramen is VF in pink. Vertebral foramen. Show me the transverse foramen. The transverse foramen, I'm just going to color it in turquoise. So that hole there and that hole there is your transverse foramen, and they're only found in the cervical vertebrae. Okay, those are the parts of the vertebrae you have to know. And this is showing all of them again, but we've covered all the ones you have to know. Then going down from the lumbar vertebrae, remember the lumbar vertebrae are the last of the vertebrae in that curve of the spine. Below that, you have the sacrum. So I'm going to show you here on my little model here. So these vertebrae up here in the neck would be your cervical vertebrae. These vertebrae here by the ribs are going to be your thoracic vertebrae. These vertebrae here in the curve, those are your lumbar vertebrae. And your lumbar vertebrae sit on this bone right here. That bone is called the sacrum. So that bone right there is called the sacrum. So you can see it pictured, especially on the left-hand side, because you're getting a back view here on the left-hand side. That's the sacrum. There is a bony spine down the middle of the sacrum. That bony spine is called your sacral crest. Then you have these holes. Those holes in the sacrum are called your sacral foramina. Then when you flip him around, I'm going to move my camera so that you can get a good viewpoint. Okay, when you flip him around, these little inside wings right here and here, those wings are called the ala, A-L-A, the ala. Then all of this down the middle would be your sacral body. You can't see it very well because of the post in my skeleton here. And then each of these holes is your sacral foramina. Then up here, the broad area is going to be the base. And the pointy bottom here, right here, is going to be the apex. So again, this entire bone is the sacrum. These two wings right here are your ala. This part right here down the center, this is going to be your sacral body. These holes, all the holes are your sacral foramina. This broad side here is the base. The pointy side right here is apex. And if we turn him around so that we see the back of that sacrum, sorry about that. This right here, the ridges, those little spinous ridges, that is a sacral crest. And you can see the sacral foramina again, the little holes. Okay. Then at the bottom of this sacrum is the pointy coccyx bone. So this is the coccyx right here. That's the end of the axial skeleton. So make sure in lab you will go over all these parts and try to identify all these parts. Next week, you will have a quiz over the axial skeleton.